Could that potentially be transferred to future generations in our family tree? Like for an example I can think
Yes.
about is like natural selection, where we've just evolved when we're looking at someone from far away. If they're trying to hug us, first thing we look at is their hands, because we've evolved to think that they might be carrying weapons,
Mhm.
or how we look at competition in general. Is that something that could also be playing to future generations?
Yes. Yes. This is some of the amazing knowledge that we have now that we did not have very long ago. And in the book that I wrote, which is designed to be accessible to anyone and everyone to learn something about themselves and about other people and about what may be going on in our lives.
Maybe a good place to start here, Paul, is to define trauma and what that means for people, because I guess people may have different interpretations of how to really define it.
Hmm. Hmm. Right. I mean, the word trauma can have a lot of different definitions, of course, but the definition that I'm choosing and settling on that runs throughout the book is anything that happens to us, which can be acute, or it can be the result of something that's chronic, or it can also be something that's vicarious, right? But we experience the trauma, and it's defined as such because it leaves us different as we move forward. So it overwhelms our coping skills, right, as we're experiencing it, and then it leaves us different as we move forward. So the idea that some kind of relatively small thing can be a trauma, like we could apply that word to it, but not in the context of having a deep impact on our brain biology and our psychology. If we're interested in trauma from that perspective of what is changing us, right, and what is making life different and harder for us as we go forward, that's the definition of trauma. It overwhelms us and it leaves us different as life moves forward.
Got it. And you're saying it could actually affect the biology, and chemistry of our brains and bodies, because I guess that is the one thing I had initially is like, let's say you had, I don't know, like a bad date and you have a certain prejudgment of like this particular person or whatnot,
Right.
and that affects how you approach your dating life with this particular type of person, let's say, and you have prejudgments about that person, even if it could be completely wrong. Is that counting as a traumatic event?
No, no. Wait, it might be something adversarial or something averse, right? It could be something negative, right? Or maybe the event itself wasn't negative, but the person's response to it. Maybe the person was having a bad day and blames the other person, right? And then reads something negative into people who look like that person, right? I mean, it could be a mistaken perception or a bad day, something averse, right? Those are, those things happen in life, right? I mean, if we get out of bed in the morning, those things are going to happen, right? But the definition of trauma is it's not a soft definition, right? It's based in the hard science of the absolute truth that things can happen to us that change our brain function as we go forward, right? It can change the genes, the way that we pass on our genes, whether our genes are active or not. It can change the emotions that we associate with our memories. It can change vigilance mechanisms inside of us when we meet new people. So what we're talking about changes the brain, and it's identifiable through routes of science. Now, we can't just scan someone and see it in all of us. We often have to figure that out by talking with someone or taking stock of ourselves, right? But we can understand that something has happened that leaves us different moving forward. That's why this is based in science and medicine. It's not a soft concept. Does that make sense, that part?
Yeah, no, that makes sense. That makes sense. And I think you also mentioned about like the different types of traumas that exist. Can you break that down for us?
Sure. Traumas can be acute chronic and vicarious. And the easiest way to start is with acute trauma, because that's the one that we can understand. A lot of our research and clinical understanding of trauma comes through military combat, right? It's when people first started being interested in like the impact of soldiers, coming back from war. And what we know is that acute trauma, so think about a combat trauma, an assault, right? An accident, the loss of a loved one, right? These are events that we can see very clearly overwhelm our coping mechanisms. So overwhelm what our brain is trying to bring to bear, right? To handle the trauma, right? And then pathways change, sort of short circuit inside of us. And now we're different going forward. Right. Now, while that's most obvious in cases of acute trauma, it can happen in chronic trauma too. So if you imagine someone who's going through life and constantly being made to feel less than, right, a constant sense of vulnerability or of lack of safety in the world around the person, and there are many reasons that can be based upon gender identity or socioeconomic status or immigration status, right? Like these are things that people can experience, right, as they go through life, being treated or seen in a different way that then weighs on that person, weighs on that person's coping skills, right? And it's much less dramatic than an acute incident. And now everything is different, right? But it can make those brain changes nonetheless. And we can also experience the same brain changes vicariously. If you imagine the person who's been glued to the news and watching and identifying with so many awful things happening in the world around us. We're blessed as a species with empathy, right? So we can feel other people's pain and suffering, and it's good that we can do that, right? That's why it's why and how we can relate to people and help people, right? When they need our help, even though they're different from us, right? So empathy is good, but it also means that we can relate to other people's trauma, and sometimes those brain changes happen because of someone's such strong identification with, for example, parents trying to shepherd out of danger, children in the Syria crisis, right? Or now in the crisis in the Ukraine, right? That we can identify with people and vicariously experience their trauma, and it can therefore change our own brains. And it's not a soft conjecture, right? This is absolutely in accord with what the science tells us.
Right. And I guess, how does chronic trauma affect you differently than acute meaning, I guess, like there's a specific event that happened and that was probably unsuspected, and that leaves you a different person moving forward in how you interpret that. Whereas a chronic, it seems like something that you've just gone through, maybe it's low acuteness, so it's like small things that just kind of accumulates over time. And an example I can think about is, like, I interviewed this woman named Yeonmi Park, and she escaped North Korea. And the experiences she's been through, from going into North Korea, escaping, go to China, go to Mongolia, and then eventually making it down to America, it almost seems incredibly traumatic for a regular person to go through that. But for her, because of her upbringing in North Korea and the regime that she's experienced, she's been through, it's almost like the things that she describes, there's a numbing feeling to how she deals with it. And it, I guess it almost doesn't seem traumatic when she describes it and how she feels, because of the norm, like how normal it is for her to go through these and see these different traumatic experiences for a regular person. Right.
So most likely what I imagine as I hear that is that she has had to make adjustments, right? Inside of her, her brain has had to make adjustments in the service of survival, right? That probably, if on any given day, she had a full apprehension of her situation and the tremendous risk and all the awfulness of it and the terrible things that could happen, right? That would be terribly overwhelming. Right. So what happens is the brain tries to numb itself little by little, right, in the service of survival. And it would be very surprising to me if the person you described didn't have brain changes associated with chronic trauma. Right. And, it's like, you think about the mathematical principle, right? I mean, if you have a weight on one side of a scale and you have an empty empty cup on the other, you could pour water in it all at once and make the scale change, right? Or you could pour it in drop by drop. You could pour it in little by little, but eventually the scales do change. And while acute trauma and chronic trauma and vicarious trauma look different from the outside, right, and their impact upon the brain occurs over a different time period, you can nonetheless get to the same brain changes on the other side of those traumas. And again, it's scientific fact. It's not a soft assertion that, like, as we were starting off saying, like, is everything negative trauma? And no, it's not things that are adversarial that can help us build strength or character or reflectiveness. Like, this is not what we're talking about. We're talking about being overwhelmed, and on the other side of being overwhelmed, being changed.
Right. And it's all, you're saying at the end of the day, it is a personal experience. So what someone may interpret as a traumatic event, this exact same event could not be as traumatic or traumatic at all for another person.
Right. How we're impacted by traumatic things, right? It depends on many, many variables. So some of them are genetic, right? Some of them are life experience, right? What are the particular idiosyncrasies of what can get to me versus what could get to you, right? I mean, we're different people with different genetics, and there are things you could say, wow, if they rise to like severe traumas, you would think, well, that could be likely to impact anybody and everyone, right? But there are many, many traumas that may or may not impact a person in a way that leaves them different. There's a whole theory around the multiple hit hypothesis that says a person can often have multiple hits of trauma, right? But then one of them pushes the brain into those changes, right? So that's another factor too, right? It may be that, I have 4 or 5 hits, but I sort of do okay, because there's resilience in me, or maybe they didn't quite get me in exactly the way that overwhelms me. But it might be that 5th or 6th or 7th that then is the trauma that tips over to the changes in the brain. So it's our genetics, it's our life experience, and it's also our trauma experience. So right, we have to look at the seed of the trauma, but then the soil that it falls into, which is the soil of each one of us and who we are and what our life experience is.
Right. When you say these like 4 or 5 hits, are you talking about, does hit mean a very similar type of traumatic experiences that have accumulated consecutively over time throughout your life? Or are these just 4 or 5 random different traumatic events such that your brain just can't handle it over time?
Yeah, they could be. I mean, often they're different kinds of traumas, right? And you say, well, how badly does that traumatic event impact the brain? Right. And it may be that it was a car accident many years ago, right? But the brain was not changed going forward, but that taxed the brain, right? And then there's another trauma a few years later and another trauma a few years later. And then you might have something relatively minor that happens after that, but it's that tips the brain right into the changes that we're talking about.
Yeah, I guess I'm curious to know with traumatic events, just given that experience usually can toughen us or oftentimes weaken us as well. But there's this thing around like adaptations that we have around just how we've been evolved over time. Is there such a thing that can relate to traumatic events as well, such that your second or third traumatic event won't impact you as much because maybe you've toughened the experience and kind of your resiliency around dealing with that, such that, after your 4th or 5th one, maybe you can handle it a little bit better versus the first or second time?
Under ideal circumstances, which unfortunately are not common in the world around us, that could be the case, right? Unfortunately, very often, most often, traumatic events go unexplored, unprocessed, right? They sort of stay inside of us and they then carry that negative weight, right? But it doesn't have to be that way. So if you imagine if a traumatic event happens and a person does think about it, reflect upon it, talk about it, right? And comes to a sense of self that is strengthened by it. So for example, like that thing happened to me and that thing was very, very difficult. So imagine an assault, right? Which will, trauma reflexively creates shame in us, right? So imagine a person is assaulted and now there's a reflexive feeling of shame, right? That often happens in us, right? Like, that was my fault. What did I do wrong, right? What did I do to bring it on myself? Am I cursed, right? Like, these are things we often think about after a trauma like an assault, right? So imagine the person thinks about that, reflects upon that, talks to trusted others, gets some therapy around it, for example, right? And really comes to terms with that, of saying, look, that was not my fault, right? It was the fault of the person, say, who attacked me, right? And what did I show during that event? I showed strength and I showed resilience. I was concerned about other people, right? Even in the immediate aftermath, right? And I pulled myself together and I got help, and that this was someone else's fault, and I responded, right, with health and with strength in myself, right? Now we can build our internal reserves and build our sense of self and build our strength, right, as a result of the trauma. So it's not impossible, of course, and that does happen, but unfortunately we don't often recognize trauma, right? Because trauma creates reflexive shame. We're much more likely to hide the trauma inside of us. So it can go the good way that you're saying, for all of these reasons, a really broken healthcare system and a broken mental health care system, the reflexive shame that trauma makes inside of us, that we often hide the traumas and we should keep them inside of us and accumulate them, which is probably a reason the multiple hit hypothesis is true, because we most often carry the weight of traumas, and then it's a subsequent trauma that can push us over into now really having those brain changes that make us more fearful and more avoidant and more vigilant, and all these negative things that can happen to us.
Yeah. And before we're going to go into about identifying what happened, how we can identify traumas, like maybe we can just do a quick breakdown of what is happening to our brain and body and what the connections around that are as we go through trauma and, even repress trauma and suppress that experience.
Right. There's so many changes in us, and science is really just at the beginning of understanding these changes. But I can highlight two that I think are very striking, right? I can highlight two changes. So one is in the brain. Right. So there are vigilance sensors in us that are active to greater or lesser degrees. Right. And after the kind of trauma that we're talking about, that overwhelms the coping skills and leaves the brain different going forward, we can have shifts in vigilance mechanisms that make us see other people through a different lens, right? And it's a lens of potential threat, right? So the changes in the vigilance mechanisms would mean that, say, if, for example, I meet you for the first time and I don't know you, right? That without the changes in the brain, I might think, okay, here's a new person, right? Like maybe something interesting could come of this, right? Like maybe we could get along, and, and I'm interested in you that way. And how do you look like you're responding to me, right? Like there's a curiosity and an openness, right? Whereas after trauma, the brain mechanisms really shift to looking primarily at, hey, are you a threat to me? Right. And that might not necessarily be just like a physical threat, right? Not just, oh, you're going to attack me, right? But more, do you mean well towards me, right? There's a little bit of suspiciousness, right? And you imagine how that can change things as we go through life, as we meet new people. And does that help us make new friends? Does that help us get ahead in our job? Does it help us find the right person to date, right? Like it doesn't help us with these things to have an approach that's automatically about, are you a threat to me? Right. So imagine like that's a shift in the brain, and it's a huge shift that changes our psychology in all sorts of ways. Right. And I would say another aspect is changes in our immune system, right? That the stress of these changes in the brain then can change how our immune system functions and can make us more vulnerable to all sorts of things, from autoimmune diseases, right? So illnesses like lupus, for example, right, is just one example. It can make us more susceptible to cardiovascular disease, right, to heart attacks, right, to strokes. So you imagine now we're talking about just two changes in the brain and in the body that can affect absolutely everything about us, including our very survival. And that's true. That's not conjectural. Those things are true.
Yeah, no, that's fascinating. And even around how this can be passed around through our generations, let's say if we have kids and our grandkids, is there a chance that if we don't deal with the traumatic events that have happened and that makes up our brain and our bodies, could that potentially be transferred to future generations in our family tree? Like, for an example I can think about is like natural selection, where we've just evolved when we're looking at someone from far away. If they're trying to hug us, first thing we look at is their hands, because we've evolved to think that they might be carrying weapons, or how we look at competition in general. Is that something that could also be playing to future generations?
Yes. Yes. This is some of the amazing knowledge that we have now that we did not have very long ago. And in the book that I wrote, which is designed to be accessible to anyone and everyone, to learn something about themselves and about other people and about what may be going on in our lives, right? The truths inside of us and in the world around us. And in one of the chapters, I interviewed Darren Richarder, who is a trauma researcher at Stanford. And Darren is a great expert about trauma in terms of the biology and also the impact on people, including across generations. And in that discussion with him, we talk about this, how trauma now can impact how genes are passed along years and years later. So in some of Darren's testimony, for example, in the International Court of Justice, right, the idea was to look differently, look truthfully, for example, at rape as an act of war, right? Where it for so long was seen as a sort of one-time event, like something bad and something criminal happened, right? And that needs to be understood and assessed, but it was very sort of time limited, right? But our new understanding around trauma says this is not a one-time bad event, right? But this event impacts that person throughout the rest of that person's life. And it impacts that community in an ongoing way. And it impacts how genes are transmitted even years down the road. So you may have children who are predisposed to greater vigilance, children who have behavioral changes because of the change in how the genes are expressed that could come from trauma years and years before the child was even conceived.
Wow.
So imagine that truth. Like, we know that now, yet we don't respond to trauma that way. I mean, the International Court of Justice is interested in hearing someone with the expertise of Darren Richarder testify, right? And like, that's obviously a very good thing, but it hasn't made it into our daily lives, right? When we think about how are we behaving in the world? How are we taking care of ourselves and the people around us? Are we making impacts that affect people across the rest of their lives, that affect their children, that affect our societies, that affect how productive we can be in our societies, how happy we can be? There's so much going on, yet we kind of just wantonly sort of stumble forward, right, through all these difficulties in the world, the opiate pandemic, right? And you talk about a true pandemic, right, of opiate overdoses and deaths in the tens of thousands. And then, of course, the COVID pandemic and racial injustice in our societies. There's so many traumas that we just sort of run forward and we don't look at what are we leaving behind, right? And if we don't attend to that and try and understand it and try and help people and try and prevent trauma in the first place, what we're doing is we're changing ourselves and changing our societies for the worse. And if we don't do something about that, it will have a cumulative effect that really puts our survival at risk. And I don't think that's a catastrophizing thing to say. I mean, I think if we just stand back and look at what the science that we understand and what's gone on in the world, right, even over just the past several years, then I think it's hard not to look at it and say, wow, we really run risk to our survival as a species. And that includes climate change and so many other things that if we don't look at what's going on, right, and if we don't look through a lens that's not the lens of trauma, right, the lens of I'm just trying to take care of myself, or I'm angry or frustrated or scared or ashamed and I'm just retreating into myself, right, if we don't work against that, I mean, I don't know how it's hard to not see that we're all at risk.
Yeah, that seems to be the biggest shift in terms of the perspective of how we see that lens of individual trauma and dealing with that, which makes it more like micro. And if that person doesn't deal with it, or if I don't deal with it, it's my own problem and it's that person's own problem. And that makes a problem super small scale. But as you described, looking at a macro scale and how this can impact on a collective society and what results that come from that, I would imagine this would be a completely different way of how someone is motivated to deal with their own, but also how we punish from a legal system certain things that can cause other people trauma, so that it's not just one for one, because sometimes like it does have that collective of impact in terms of how severe this trauma is. That's fascinating.
Thank you. Yes.
Now, sorry, were you have something to add to
no,
that?
I agree
Yeah.
completely. I mean, you're making the link from the individual to the broader society around us, right? And how we have to be responsible, right? If we're just running, rushing along headlong, right, into the future without taking a look at, hey, are we taking care of ourselves now? Right? Are we trying to prevent, right, things that put us all at risk, right? Then we do put ourselves all at risk, right? Because we're not looking at the factors that put us in that precarious situation. And I think that there's just such a very clear truth to that there's so much that we are ignoring as we rush headlong into the future, and we don't stop and look at the impact that it's having on us. I mean, if you think about our greater interconnectedness, say through social media, right, which sometimes allows for greater understanding, right? Like, I think good things can happen, as I think, your podcast is, right, you're trying to get understanding out to people and start dialogue, right? Like, there's a lot of good things that happen through social media. But imagine the impact of trauma in a time, an era when we're so much more interconnected, right? That people may be much more likely to say, hey, I'm going to go search for people out there in the world, right, who are different from me, not so that I could understand them better, right, but so I can assail them, right? So that I can be angry and aggressive towards them, right? And if you think about that defensive mindset, right, of, hey, if I don't know you, right, are you a threat to me, right? It's much harder than to have empathy and to say, hey, well, we're all in the same boat. We may be, different socioeconomic status or sexuality or gender identity or race or religion, right? But does that matter, right? Like we're the same in what we're up against. And it's trauma that leads us to be in a more defensive position where we're much more likely to identify other people and the differences we see as a threat, right, which then evokes aggression, right? And I think that we see that in the world around us, how much behavior from people in public positions, right? How people treat one another online, right? Ways that people would never do, how people can ally around agendas that are aggressive or racist or demeaning to other people, right? And I think it's not an accident that there's a lot of that going on, right? Because if we don't look at the trauma in us, we don't look at how it predisposes us to aggregate into groups that seem like we're similar, to over-identify with that similarity, to become more suspicious of others and the world around us. And it's these changes inside of us that really determine our behaviors. And if we're going to come together to solve the problems in our societies, right? Or are we going to just look for differences and fight each other to the death, right? Or while we're busy fighting each other, right, there are dictators and other aggressive people or climate change that bring us all down.
Yeah. No, I mean, in many ways, this could be one of the many deep-rooted issues around why people associate social media with such negativity and darkness, is that now we have this double-edged sword, which can be a very powerful tool if we leverage it. Right. But now that everyone is connected, as you mentioned, everyone has a voice. Everyone has the ability to reach millions of people because we're so connected. And it could be a very positive experience if everyone is uplifted, but it could also be a very dark place because especially with trauma, the biggest thing that really hurts us is when someone attacks our identity, because that's a lot of who we are. And when we have shame around certain experiences and we identify people that attacks our identity, that's like a calling to put negativity out in the world. And combine that with, how connected we are, thousands of years ago when we lived in tribes, like even if you had so much negative energy, it wasn't going to reach such people. But it seems to be something we really need to get on top of if we want, and it's only going to be more connected over the next 20, 30 years. So yeah.
We're at huge risk if we don't understand this, right? Otherwise, our interconnection just allows us to hurt each other more and more, right?
Yeah.
And we don't want that. If the interconnection makes more harm than it does good connection and healing, right? And unity, and say, oh, I don't, look, you and I could be different in so many ways in our backgrounds and age and experience. But look, we can connect and see similarity between us, right? And maybe we have a shared agenda of wanting the world to be a better place. But if that is outweighed by the negativity and all of the aggression, right, that comes from feeling hurt and stigmatized, basically traumatized with all those changes in the brain, then like, how's that going to go going forward, right? I mean, if the bad outweighs the good as we run that forward, where is that going to end up? And I think we see it in being dissociated from facts, right? I mean, the idea that people so often really don't necessarily want to be right as much as they just want to say their piece, right? And you see this where even two people may have a disagreement, and it may be clear that one is right and the other is wrong. There's nothing to do with politics, right? Like something like a crowd size, right? Like, hey, you can look and see that is bigger than that, right? So why would people insist on the opposite, right? Because then it's divorced from what's actually true, right? She says, I want to assert myself, right? I feel weak, I feel disempowered, I feel angry, I feel frustrated, I feel vulnerable, I feel unsafe, and I just want to assert myself. That's why I'm going to double down on what I say, even if it's obvious that I'm wrong, right? Because it's not about right and wrong. And now we're really in danger, right? If it's about anger and frustration and fear and how that can manifest itself as aggression that's really not tied to any rational agenda, boy, we're really in trouble. And there's a lot of that going on, and it's going on both ends of the political spectrum. I mean, this isn't a political argument that I'm making. I think it's going on both ends of the political spectrum, where it's more important that I have my say and have it my way, right, than it is that I think about things, reflect, listen to someone else's opinion, integrate facts into my head and come to, oh, maybe we disagree. And I say, actually, you're right on this point. Wow, okay, like let me take that, think about it, and I may have new points to make to argue with you another day. But like, we don't see very much of that, right? We see, oh, now I'm even more infuriated. If it's become clear to me that you're right and I'm wrong, I'm going to double down on that. And then maybe the attacking starts getting personal, right? Because, it's not about learning or communicating, right? It's just about asserting, right? And, it's hard to look at so much of what's going on in the world around us to not see like, hey, that's really prevalent.
Yeah. And I guess the next logical step here is to talk about what are the ways to identify the traumatic events that have happened. Because I see it sometimes from the other perspective of growing up in a home and culture in South Korea, where the idea of talking about your emotions and almost like normalizing not going to therapy and not talking about your emotions and traumatic events is the norm, particularly with like the masculinity environment there. So I've never actually even had the tools to talk about that and mostly, repress a lot of these things. So I guess like, what are like the first steps for someone to even identify? Some people may not even think they've had traumatic events, but they're just consciously repressing it. Well, what are kind of the first steps someone takes to start identifying it?
That's a great question. And the answer, I think it's like a good answer to the question, right? Which is that there's simple things that each of us can do today, right? Even if one has had no experience with even the idea of mental health or the idea that something may be going on inside of us. Because if something has happened to us, we know, but as you said, we push it down, right? We suppress it, right? And we can just stop and pay attention to what is going on inside of ourselves. So two examples of that. One can be, what is our self-talk, right? That we very often do not stop and think like, what am I saying to myself when I'm walking from one place to another, right? Or when I'm in the car driving from one place to another, right? In the moments between doing one thing and another. And very often we'll learn right? If our self-talk is saying negative things to us all the time, right? I mean, that's something to really take note of, right? The idea that what we're saying to ourselves is really indicative of what's going on inside of us. But even though we may be saying it to ourselves over and over again, we're not aware of it, is just begging for us to stop and pay attention to what's going on, right? And if you see I'm saying negative things to myself all the time, or harsh things to myself all the time, right? So, drop a pen and say, oh, you stupid son, is that what I'm saying to myself, right? Like what's going on there? Because does it really make sense? I mean, we don't think that of others generally, right? If somebody drops a pen, we don't think, oh, what a stupid fool, right? Right. But if I'm doing that to myself, like, what is it telling me? And was that always going on inside of me? Here's a hint. The answer is no, right? I mean, just as an exaggerated example, like nobody comes out the womb, right, saying terrible things to themselves every moment. Now, of course, we're not developed that way yet, but the point I'm making is that that's not natural in us, right? So what point did that start happening, right? That we can start to become interested in it, curious about it, right? The same can be true. The second example is of creating a life narrative of what do I actually think about my life? What do I have to say about my life? Is it that, oh, I'll never get anywhere, or, I'll only have bad relationships, or I can't have a better job, right? Is that what's going on inside? Is that my narrative of myself, right? Because we can get curious about the narratives inside of us, right? And then if we see things that are pretty negative, we can think, okay, where did that come from? And it's remarkable how often doesn't take much when we start thinking about these things, we kind of know the answers, right? Or if we don't, we can write about it, right? And reflect on our writing, talk to someone that we really trust, right? Or that's a great role for therapists to play, right? To come in and talk. I mean, how many times I've talked with a person about what is their life narrative, and if their life narrative is very negative, right? I'll never find somebody. I can do well at work, and I can take care of myself that way, and I've got a good place to live, a good roof over my head, but I'll never find a good relationship, right? Okay, that's interesting. Why that outlier? And then, we can trace back sometimes to say a real trauma that happened in a relationship, right? Maybe there was an assault in a relationship. Maybe someone, a partner disappeared very quickly. Maybe a partner lost their life, right? Something that changes what that person feels inside going forward. And we can go and look at that, and we can look at the fear and the shame that may have been created, right? And how that now keeps something inside of us that we need to get at in order to be healthier. The parallel that's often used is to an abscess, right? Medically, an abscess is in an area of infection inside of us that gets walled off by the body, right? So sometimes we can have abscesses, say, in our abdomens, right? And, they kind of spin off symptoms, right? Where we might have a low-grade fever, or just not feel great, or you have the sweats every now and then. And so the abscess isn't killing us in that sense, but it is hurting us and harming us, and it's impacting our experience of life, because there's something that's pathological there that needs to be taken care of, right? And if we lance, or we go in and we clean out that abscess, now we don't have those symptoms anymore. And the thought is these traumas that we carry with us are like abscesses, but they're in our psyche, right? They're in our minds, and that we can go and we can look at them, and we can shine the light of day. We don't have to be afraid of them. And when we think about them, talk about them, process them, then they're not hurting us anymore. And I've seen that more times than I can possibly count. Like, it's not theoretical. There's just like a common sense to like, oh, that's exactly how this can play out when a person realizes, right, puts some thoughts in words, and sometimes comes and talks to someone about it.
Yeah. And I guess like the first step is really just being aware that you are having a negative self-talk in the first place, because most people don't even realize it's just part of their natural habits. Yeah.
Right. We have to stop and think what's going on inside of us. And it's remarkable. So many times we're so busy, right? Like you're just sprinting through life, that we don't stop and say, what's going on inside of me? And if you do what I do for a living, you say that to people a lot, right? And it's like, it's a great process. It's so enjoyable. I mean, sometimes it can be arduous, and, there can be tears and distress, but like, that's okay. That's often how we heal ourselves and how we get happier and healthier, right? So it can be such a joyous and healthy process to get at all of this, right? And I try and write about that in the book, where I write about real stories of real people, and ways in which people come through trauma, right? And ways in which in getting the right help, or sometimes just having the right mindset and reflectiveness in us. We don't have to be just made less and less healthy by trauma, but the opposite can happen. And I think there's some very, very heartening stories in the book that I've gotten really good response from people who like read them and like they really resonate, with them. And again, there's stories of people, right? So they may be a very different person and situation from the reader, right? But there shows our common humanness, right? That we can be helped and healed by other people's stories, right? And there's the truth of how the empathy, right, that can make vicarious trauma in us can also be used for healing between people, whether it's through a story or it's through even our own communing with ourselves and our reflections and our writing about ourselves, if we choose to do that, or in our communing with other people, friends, family, professionals who can help us.
Yeah. I mean, that seems to be the most powerful note, is like, what is the story that you tell yourself inside of your head? Because that impacts almost every decision and how big you can think. I mean, an example is, you tell someone to look for the color red around the room and you just say red, 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 red. And then you ask them to look for the color green, and it's all of a sudden incredibly difficult, right? Because your brain is so fixated on the color red. And when maybe you had a traumatic event where your parents got a divorce over money issues, and you'll associate money with evil or bad things or greediness. And then you tell yourself that you're not the kind of person that wants to make a lot of money. Well, that becomes the story of how you deal with your career and all of these different things. Like, it's such a powerful thing. It just accumulates over time. And story
it's
that
a
we
great
tell
example.
ourselves.
Yep. It's a great example, right? Because you're highlighting something where really one thing has nothing to do with the other, right? So say a parent's had a difficult divorce, is over money, right? That doesn't have anything to do with making enough money later in life to like support oneself well, right? Or to say, hey, if I feel like I'm not being paid fairly, right, then I want to assert for myself, right? But we make one thing have to do with the other, right? Through the stories that trauma create in us, right? So I think you gave a great example in how like we don't see that unless we go and look for it. And the person can think, right, I'm not a greedy person, right? And I'm not just after money. Okay, well, that may be true, but that story may have become so oppressive that says, I don't get paid fairly for what I do. Right. And like, that's not empowering now. Right. But we so often cannot tell one from the other unless we go and look at it and we look at, why did that idea get into my mind? And maybe that person needs to grieve, right? And share their fear and how awful it felt when their parents got divorced and they were yelling about money, right? And that the experience of that grief helps the person come to terms with that, so they're freed of the weight of it going forward. Right. And they can say, right, I am not a person who's greedy about money, but I am a person who wants to be paid fairly for what she does. Right.
Yeah.
We could say that about ourselves, right? Because we know that, hey, those two things are different. And now we have the mastery that knowledge can bring to us, right? None of us likes knowing that, this idea that, oh, maybe we're going through life just kind of unconscious and I'm doing things automatically. Nobody likes that. Right? It's like, hey, I want to understand myself. I want to feel like I'm in the driver's seat of my life, right?
Yeah.
And trauma and the changes it makes in our brain can put us in the backseat of our lives, right? And that's part of the message I'm delivering is, hey, this is not good. I don't like that. I'm guessing you don't like that. And no one listening to us likes that. Right? There's something we all have in common. So we can use these resources around us and just our own reflection. There's a resource, right? So that we're not controlled by something and acting automatically because we don't understand the things that have gone on inside of us and how they affect us. I don't like that. And I want that to change as much as possible in all of us.
Yeah. It really reshaped my thinking about openly talking about traumatic events or just events that I may have felt ashamed from, kind of like reflecting back to Carl Jung and the thing he talks about shadow work, where, if you didn't embrace the entirety of your being, how can you live a full and fulfilling life if you just aren't able to go into the darkness and embrace that? When someone is trying to talk about, let's say someone feels like, okay, I'm ready to talk about my events and what have happened to me. What are some tips that you can share around how they can talk about it and what to degree how open they should be and how they should even frame that event? So for example, I've had people talk about events, but they kind of downplay it because maybe they don't want to feel that shame, or they are trying to repress it even while they are trying to openly talk about it.
Right.
What are some tips you have around like how to actually talk about it when they are ready to communicate?
Right. Right. No, again, you're asking just great questions. I mean, the setting has to be one where the person feels safe, right? Because if a person is going to talk about a trauma and how it's impacted them, they have to be able to be open and honest about it. It doesn't help us to minimize my traumas. Oh, that wasn't really that bad, or other people have had worse. I mean, that's a standard refrain, right?
That's the
Well,
thing.
this thing happened to me, but it's not like, and then they'll think of the worst things we see on the news, right? The Syrian parents with the children strapped to their back trying to swim across a body of water, right? And then we can use that to minimize our own traumas, right? And like, that's not helpful. That's never helpful to anyone. So yes, that is something awful that has happened to that other person. And I have an investment in trying to help that not happen, right? Or trying to help people who've been subject to that, even though I don't know them and they're half a world away. That's true, right? But that does not minimize my own trauma, right? Because we have to be able to be open about it, because, as you said, like going to a dark place, right, to talk about trauma or think about trauma often very much scares us, right? And we're worried, oh, if I go to a dark place, because it's dark and mysterious, right? And we worry that then I won't come out, right? And people will say, I can't talk about that. I'm worried I'll start crying and I'll never stop, right? We hear that a lot in what I do for a living, right? If you think about it, no one ever just starts crying and then never stops, right? No one ever starts crying, can't stop, and like dies of dehydration because they can't stop crying, right? So, but we all say that or feel that at some point in time, right? If I go there, I'll never come back, right? I'll be lost in that darkness, whether it means I cry forever or I'll lose myself in it, right? And you think, what an effective lie that trauma tells us, right? The very thing that you have to do, which is go shine the light of day on that trauma, right? And it may be difficult and it may be arduous and you may need help with it, and the help may have to unfold over time, and you may cry and you may be terribly upset. Like, all those things may happen, but none of those things make us less healthy, right? By doing those things, by coming to terms with trauma and the impact it's had on us, that's how we gain mastery. We shine the light everywhere that trauma tells us, no, you have to keep that secret. And then it keeps the abscess going, right? It keeps the secrecy going. It keeps the fear and the shame going, right? Whereas what we need to do is exactly the opposite. Go and look at it, shine light all around it, put words to the thoughts and feelings. And when we do that in a safe setting, lo and behold, we get rid of that abscess, right? That psychological abscess, and then it stops impacting us. That's how the person lets go of, in the example that you gave, right? I'm not greedy about money. They go back and they look at, like, how did that feel when that divorce was happening? How afraid did that person feel, right? Did they feel responsible for it, right? Because often kids will feel like it's my fault, right?
Yeah.
And people have to say that, and they know as an adult. How many people have said, I know as an adult, now I'm 30, 40, 50, 60, 70 years old, I know that a 5-year-old doesn't cause a divorce in their parents. I would say that to anyone else on earth, that's not your fault, but I feel that, right? I still feel it, but you don't have to feel it. If you go and you process it, you set yourself free from feeling that. And now the trauma isn't weighing you down. And now that person can go and say, okay, but like, I want to be paid fairly. I want to be treated fairly, right? I deserve just to save money in order to take care of myself and the people around me. And, there's so much that then we can own in a way that makes life more simple, right? Good mental health is always consistent with just simple principles, right? It may be that it's extremely complicated what's going on in our brains, because our brains are wildly complicated, but the principles of health are simple. And if we can shine the light of day on the things that have happened to us, talk about it, write about, recall, feel the traumas that have happened with us, then we don't have to have them be anchors, right? That then tie us to the past in ways that control us and say things like, oh, I'm not greedy, so I won't take care of myself financially, or I can take care of myself financially, but I'll never have a good relationship, right? Or no one will ever really like me for who I am, and people will always sort of pretend, but I'm always cut off from other people. Like, these are the stories we tell ourselves. And if we don't go and look at the trauma, then you imagine all these anchors right, holding us to the past as we're trying to drag ourselves into the future, right, and sprint through the future, right, because there's so much going on, and now we're trying to do all that with the anchors of the past, and like, it doesn't have to be that way.
This may be a slightly unrelated symptom, but do you think imposter syndrome, which is something that I deal with, that most successful people deal with, come from some form of shame and trauma? Is there some relation to that?
Again, it's a great question, right? And honestly, I don't have an authoritative answer. I don't think anyone has an authoritative answer because it's so complicated. But I think that there can be elements of that where you can see a dramatic kind of imposter syndrome, right? Where people can feel with things that are relatively low valence, right? So the person who just goes to work and does a good job, right? Or is just a nice person when they're dating someone else who feels like they're an imposter, right? Like that will often link back to trauma because all the person is doing is like, they're just being a good person in the world, right? But they feel that there's something less than inside of them that the world is going to see, right? That I think is much more often related to the impact of trauma. It's a little bit different if you look at very, very highly qualified people who feel like they're imposters. That can come because the conscientiousness and some of the obsessiveness and compulsiveness of highly qualified people can lead those people to have very skewed impressions of themselves. So for example, I remember it's true sort of working with a surgeon who, and I'm just making up the numbers because I don't remember exactly, but who did very complicated surgeries and had, say, on average 4 or 5 complications a year, right? Whereas other surgeons, like really, really good surgeons in that discipline, have on average 15 complications a year, right? But this surgeon feels like a fraud because it feels like, oh, those 4 or 5 complications should be 0. Right now, in some sense, okay, there's a balance there between the conscientiousness and the perfectionism that can lead a person to be so good at something, right? And then how that person can then sort of self-persecute about that. Like it gets a little more complicated, but I think the roots of a lot of imposter syndrome that's going on in just the regular old us as we're going through the world day to day, often are rooted in trauma and this sense inside that, hey, really inside, if people really looked at me, they would see that I'm not good enough.
Yeah, I'm wondering, as you're dealing with clients that maybe have imposter syndrome that are perhaps in the other end, where they are actually very high qualified, exceptional at their craft, but because of that and like the way they got there was through some level of imposter syndrome, which allowed them to work harder to get to, although this never ending flywheel of like continuously not feeling like you're good enough, but it doesn't end up making them improve faster. Is there some level of healthy imposter syndrome that you encourage people to have? Like when I think about kind of myself is like, I am the most critical of what I do and what I don't do, but it actually allows me to perform better. And I guess some hesitancies that I might have around trauma is that, or like healing trauma, is that it might remove that edge.
Absolutely.
That I have.
Yes, you gave the perfect example. Like that is exactly what happens, right? Is when a person is good at something, right? And it could be professional, it could be personal, it could be raising kids, it could be growing a garden, it could be doing their job really, really well. Whatever it may be, there can be a fear that if I go a little bit easier on myself, like I know that there's trauma in me, and often we know that there's that thing, or there's that other thing, or this weight on me, right? That if we go and we take care of that, if we attend to that, right, that we will lose our edge, right? And we'll get complacent, right? And really that's actually not how it goes, right? That there is a sweet spot of, in a sense, having high expectations of self, right? And saying, look, I do what I do as best I can do it. And I'm the person, if I think I'm exhausted after I've done what I've done and I've been over it 5 times and like I'm ready to stop it, if I realize, I go over it one more time, I think I can make it even better, right? Saying, okay, that's good, right? Because I have high expectations of myself and high standards for myself. And therefore I'm going to persevere, even if I'm fatigued or tired, or I've been over this so many times, right? There's a difference between that and persecuting yourself, saying it's never good enough, right? And no matter how you leave it, you have to leave it saying, you probably didn't do a good enough job, right? Like there's a difference between having high expectations and persecuting oneself, right? That surgeon, when that surgeon has that complication, right? Does that surgeon say, look, I'm doing the best I can, and I know that I'm good at what I do, right? And I'm going to look at this complication. I'm going to understand it as best I can, because ideally I want to have zero, right? I know that 4 or 5 a year is better than the dozen a year on average everyone else has, but that doesn't mean this one I just had couldn't maybe have been avoided. So I'm going to look at that, right? That's much more productive than saying a complication happens. Oh no, I'm terrible at this, right? I'm not good at this. I'm going to fall apart. People are going to see I don't know what I'm doing. That's not helpful, right?
Yeah.
So self-persecution is not the same as having high standards for oneself. And that's what we want to live in, the high standards, not the self-persecution that comes often of trauma, or of too much of a good thing is never a good thing. So too much perfectionism, for example, right, becomes not a good thing. So regardless of where it's coming from, it's never helpful to be into the self-persecution range of things, because then that impacts the life narrative and the self-talk and everything else.
Yeah. I mean, it's hard to know what part of it comes from trauma and what part of it comes from conscientiousness, right? I mean, it kind of reminds me of the quote from Nietzsche about all great people play some form of actors of their own ideals. Like there is some form of acting we're doing that makes us feel like maybe we are imposters when we're trying to always improve and get to that next level of our identities. But I think it's a great explanation that you shared around that. Final question for you.
Sure.
Just around like, being in a situation where maybe you have a partner or a family member or a best friend or close colleague, and you can see that they're dealing with something, right? Yeah. I imagine some sort of form of trauma or shame. How do we help people beyond ourselves deal with that or openly talk about it? What's the best way to approach that? Obviously not as a psychiatrist or professional.
Right. What's amazing is how often we see that something is not okay in someone else, right? But we don't say anything about it, right? And we make, so often it's our own discomfort, right? Or it can be our fear that will make things worse. It was, well, if the person wanted to say something, they would come talk to me, or they've got other people to talk about, or they're probably going through something and it'll end, right? Like we say this so often. And again, I don't think it comes from a bad place in us. It often comes from a confused place, or it might come from traumas that are inside of us, right? But the idea that, hey, to have just a gentle overture to someone, right? It doesn't hurt a person, right? To say, hey, I just want to say that, I see that you've been a little different lately and you seem kind of down, or like, I know that something really hard happened a couple of months ago. Like I know you had that breakup a couple of months ago where you lost that job, or someone near you was sick and died of, had an aunt or an uncle that died of the virus, or and I could just see like maybe it's, I don't know, it looks like maybe it's taking a toll on you, it's impacting. No, I'm here to talk about it if you want, right? Or if you don't want to talk about it, to talk about the things you could do, or someone you could talk about. Just want to let you know, like it's something like that that's not, it's not overly pushy, right? It's just saying, hey, I witness you and I see something. I don't know if I'm right or wrong, but I see it and I care about you. So I just want to put it out there. Man, it's remarkable what a difference that can make, because people can go through life with, sometimes the trauma is screaming inside of them, but they go through life and no one knows. That person seems okay. And, so it's so unfortunate that at times we don't know, there's so much that goes on that can lead up to a person choosing to end their life by suicide. But so often people will say, I didn't know, that person seemed fine. And right, because they're holding something in, but often it's something that, is begging for the relief or the release that just a kind word and an overture could show. And I think just like, looking at the world around us, looking at ourselves and other people and saying in a very simple way, like, hey, if I kind of know you, even if it's just in a passing way, and I see that you're different, why do I not say something,
Yeah. And it's often the greater the shame, the less likely they're able to talk about or even bring up hints that they're dealing with that. And it's kind of the my aunt committed suicide, and none of us really suspected it. And whenever I see people cry out for help subconsciously or provide hints that they need some help, you know, I generally feel like those people are still able to be, you know, salvaged and gone through the process of healing. Whereas the people that are already ready to end, they would have just done it, right? And I know you dealt with that with a family member as well. And yeah, it's just that feeling of feeling understood, or that you can speak with someone, is so powerful. Such a small gesture on the other person, but so powerful.
I think of all the things we can do is like investing a nickel in someone else's health, and and they get $1,000 return, right? It's like it's something, it's obviously so much more important than that. But what I think you're pointing out is it can be a small thing to do that can make such a huge difference. And I think it's a reason why, if a person chooses and has thought about it, being open about our own traumas helps to reduce stigma, right? Which is part of why I write in my book about losing my brother to suicide, right? And I'm open in just the world around me. Like, I don't feel ashamed of it, right? So if a situation comes up where it makes sense to talk about it, either because I can see that someone else is ashamed of something, or I don't know, and just saying it generally out into the world, right? And I think when people who have any, stature in any way, right? Even just the fact that I wrote a book, and you can read the book, and I'm a psychiatrist, and I'm open about my own trauma, right? Or some of the way that other people have, Stephanie Germanotta, who's Lady Gaga, who wrote the foreword to my book, who is open about her own trauma, right? It has obviously a tremendous, position on the world stage, and to say that, look, I'm not ashamed of this. Like, trauma happens to us, and we don't have to keep it secret, and I don't have to be ashamed of it, and you don't either. And I think, so sometimes sharing with someone that we've been through things too, can be helpful without sharing too much. But a person can say, I noticed that you're a little different, and look, I've been through a lot myself, and sometimes things that are hard to think about or talk about or share, that can work against the stigma, because trauma says, no, you should feel ashamed of this, right? You're not going to say anything about it. You hold it inside, right? I mean, that's the whispering voice of trauma, the devil on the shoulder that says, keep me secret so I can grow inside of you, right? And continue to harm you. And sometimes an entreaty that says, hey, I see something in you, and I've got it in me too, oh, okay, person may be more likely to not listen to that devil's voice of trauma, so to speak, and, and say what's truly going on.
Yeah. Wow. Well, this has probably been one of the most powerful, important conversations I've had on the podcast. So I really appreciate your time, Dr. Paul Conti. And
thank you.
Obviously, I want to make sure people check out your book, Trauma: The Invisible Epidemic: How Trauma Works and How We Can Heal from It. We'll definitely link that all below. So highly recommend. Forward by Lady Gaga as well. Fascinating story. Where else can people find you online, and how can people learn more about you?
Sure. There's a website for me, and it's just Dr. So Dr. and then my name. So Dr. Paul Conti. Last name is Conti. And it has links to where one can buy the book online, and just a little bit more about me. Most of what's out there about me is through podcasts like this, and I'm so grateful for the opportunity to talk to interesting people like you who have a whole set of thoughts and experiences that then lead to such a good conversation. So I'm out there in various podcasts, and that website gives a link of where to buy the book, and it's in most bookstores too, most major bookstores at this point. So thank you very much. I appreciate that you've given me an opportunity to talk about something that I just feel is so important, and thank you for having me on, and for how thoughtful your questions were.
No, thank you guys for listening, and we'll see you guys in the future episodes.